In health news tonight, a clinical trial is underway in our state on a new class of drugs for Alzheimer's patients.
And if all goes well, it could potentially have a huge impact. News 8's medical reporter Jocelyn Memento live tonight in our New Haven newsroom with those details that you need to know about. Jocelyn?
And Darren, this is a phase 2 clinical study on a drug that had some success on a small group of patients with Alzheimer's in a very limited time period. It is estimated that in the year 2050, 1 out of 3 Americans 65 years and older will develop Alzheimer's, a sobering number to fast-track much-needed research, funding, and participation.
Bob Bach cares for Sister Gigi 24/7. The 52-year-old has early onset Alzheimer's disease and is on 2 medications.
My sister has improved quite a bit, but I'd like to try to see if there's a way to take her to the next level.
That next level includes convincing her to participate in the Noble study.
Now we're looking at a class of medications that is defined as being neuroprotective.
Underway at the Hamden office of famed specialist Dr. Alan Siegel, a principal investigator. The focus is on the drug T817MA and its impact on the protein linked to Alzheimer's.
It helps to preserve, stabilize the brain cells from the toxic effects of this amyloid protein, and our hope is that it will basically level out the illness so that folks won't continue to progress and get worse, but may in fact, if you will, hold on to all of the skills that they have at that moment.
Specifically, Dr. Siegel wants to know,
does this drug really have the potential that it looks like it has? And that's why we're doing the study.
patients with mild to moderate Alzheimer's who take part will be on the randomized double-blind placebo-controlled study for a year.
This is a study looking at a number of doses to see which has the most positive clinical effect and at the same time the lowest amount of side effects.
Put the watch on the other side of the pencil.
It comes at a time the number of people living with Alzheimer's is increasing.
Their families are very anxious and wanting to see something in the pipeline that is closer to a cure. But with a cure, there needs to be research dollars and there needs to be that funding.
Currently, there are 26 studies in Connecticut. If this drug proves to be effective, the next step is expanding it to a much larger clinical trial.
I think that there is hope that there is a way, and that's why I think this study will be able to help to show people that, you know what, don't just give up. Don't stick them in a nursing home where you go visit them once a week. There is hope.
At least 72,000 people in Connecticut have Alzheimer's disease. Dr. Siegel is looking for participants 55 to 85 years old with mild to moderate Alzheimer's already on the drug Aricept or Exelon. For more information, log on to WTNH.com. Darren and Ann.